Michigan Catholic Conference is the official public policy voice of the Catholic Church in Michigan. At its recent meeting, the Michigan Catholic Conference Board of Directors, which includes the 7 Catholic bishops in the state, voted unanimously to oppose legalizing recreational marijuana. We're here today because elections matter. Elections provide the opportunity to ask, will this outcome lead to a better Michigan? In the case of Proposal 1, we believe the answer is a resounding no. If passed, we believe this measure would likely cause harm for the state's families, communities, and workers. Some of you may know that the Catholic Church has worked at the street level for decades, helping individuals and families to overcome the devastating impact of drug abuse and substance addiction. Families have been torn apart, and lingering trauma requires a considerable amount of therapy. Although Proposal 1 prohibits use for anyone under the age of 21, legalization sends the signal that marijuana is safe. The opioid crisis has shown that the safer people think a drug is, the more likely they are to use it. Supporters are promising regulations and growing revenue, but in reality, the measure leaves much of the production and distribution process underground. Drug dealers will adjust their prices just to undercut the legal option. Regulatory and tax policies will be difficult to enforce, especially as the drug is illegal according to federal law. And Proposal 1 does not account for the societal costs of legalizing recreational marijuana. Other states have seen increases in marijuana-related hospitalizations, emergency room visits, drug driving, and poison control calls after legalization. Despite these harmful consequences and the financial and health impact that they are creating, none of the revenue that is generated by Proposal 1 would be earmarked for prevention or treatment programs, not one single dollar. One important component of the Catholic Conference's advocacy is to engage in policies that impact low-income and vulnerable persons. And as we all know, auto insurance rates are very high in the state, especially in low-income communities. It was recently stated by an industry leader that there is, quote, a great deal of concern in the insurance industry regarding vehicle safety in a legalized marijuana state. According to media publication MERS, increased auto insurance costs resulted following legalization in Colorado, California, Maine, and Oregon. The last thing that we believe low-income citizens in Michigan need is higher costs for necessary services, including transportation. Obviously, a lot of people are in support of legalizing marijuana, and their mind may not change. But what I would ask these folks is to please take a look at this specific proposal that is on the ballot on November 6th and consider if indeed it truly regulates marijuana like alcohol. The simple answer is that it does not. We believe that Michigan can do better to keep our communities and families safe than by legalizing recreational marijuana. Opposition from the educational community, the medical community, and nearly every sector of law enforcement and public safety in the state is a testament to that. For these reasons, the Michigan Catholic Conference, the Catholic bishops in the state, are urging a no vote on Proposal 1. Thank you.